So your surgery is about 2 months ago, and you should be feeling a lot better, but probably not all the way better yet. And this last phase of rehab really helps you reach that goal of getting back to those normal daily things that you need to do, including getting back to work pain-free or relatively pain-free. The third phase of rehab is weeks 8 through 11, and the frequency drops of formal physical therapy to weekly. And again, working on home exercises on your own on the other days. And the emphasis on this phase 3 is really to build up the endurance. So typically patients aren't feeling quite normal yet. I would expect people to have soreness, particularly towards the end of the day, or higher levels of activity or exercise. Oftentimes we can start doing some elliptical work here, maybe some walking on a treadmill with the goal of building up to some light jogging if that's within a patient's activity goals. But again, really emphasizing the core and glute conditioning and rehab. So in this process, the first goal is to build or restore your range of motion. The second goal is to build the strength, and that's really phase 2. And then this third phase, phase 3, is really building up the endurance, which is the last thing to come. There's room during this third phase to start emphasizing or focusing on areas that are particularly important to an individual. And that would include work-related goals or demands, as well as any kind of recreational activity goals and demands. So for instance, somebody who wants to get back to running or triathlon may be different than somebody who's going back to dance or a heavy labor type job. Phase 3 really starts to emphasize more dynamic exercise, single leg squats, where you're really working on form and endurance to restore normal function again.